The weeks prior to my surgery, my neurogenic pain, my sciatic pain, was so severe that I felt that my body was on fire. I'm Dr. Nathan Satler. I'm a dentist in Midtown Manhattan, and I am a patient of Dante Implicito. A few years prior to my surgery, I started developing severe, debilitating sciatic pain. I also had intermittent bouts of immobility that prevented me from participating in the events that I usually did in terms of athletics and in day-to-day movement.
Hi, my name is Dante Implicito. I'm the founder of New Jersey Spinal Medicine and Surgery, and I've been in practice about 20 years now. Dr. Satler runs a bustling practice in New York City. When I first met him, he was struggling to get through his work day, but unfortunately was in too much pain to participate in what had always been for him a release and a very active lifestyle in the gym. He presented with a constellation of symptoms, including pain in his back and pain in particular in his leg, which was worse whenever he stood or walked. He had made considerable changes in the way he operated his business, spending most of his day sitting, which seemed to help in that aspect of his life, but at the end of the day he found himself to be miserable with pain. After taking him through appropriate state-of-the-art imaging studies, we were able to determine exactly where his problem was coming from and laid out a course of treatment, including several conservative non-surgical options. Although he had transient relief from these interventions, ultimately he was left with a quality of life which was not acceptable to him. He was offered a lumbar spinal surgery consisting of a laminectomy and discectomy using state-of-the-art minimally invasive techniques.
I had the surgery, and about 7 hours later, nurses came by and told me that I had to get out of bed and start walking. The moment I put my feet down on the floor, I had no more pain. And in my mind, I knew I was cured.
Lumbar spine disc problems are far from unique. The techniques have evolved over the course of the last 50 years in spinal surgery to the point where now, in 2014, they can be done usually on an outpatient basis through very small incisions using a microscope and other special instruments. These instruments allow an early return to work and recreational activities in minimal downtime. Although Dr. Satler was able to reorder his professional activities so that he could put up with his back pain through various adaptations, he was beginning to slip into the trap of being very sedentary in his personal life. This circle leads eventually to weight gain and deconditioning, which leads to heart disease, diabetes, and other problems. Fortunately, he was able to recognize the change in lifestyle and seek appropriate care.
One of the things that was interesting is that a good few months after my surgery, I was still very protective about doing certain things, and I mentioned to Dr. Implicito that I was going to sell my motorcycle, and he said, "What for?" He said, "You can go about doing the things that you did before you had the surgery. There's no reason why you can't do anything that you want to do after surgery." And so in a way, he convinced me to hold on to my motorcycle, for which I am grateful because I still use it. And just one other aspect to be grateful about this surgery.